So ADHD is an acronym that we use to define attention deficit hyperactivity disorder, and it essentially describes three clusters of behaviors or deficits that a child might have related to inattention or some attention difficulties, hyperactivity, and impulsivity.
So the three types are hyperactivity, and that's really when the kids are just what it says, hyperactive. They're restless, they're motorically driven, almost like they're a motor in a car. So they're running excessively, climbing, jumping excessively, having trouble staying in their seat.
Blurting out answers. They cannot be controlled despite multiple attempts at redirecting them. And it's really out of their control as well.
The other one is kids who are inattentive primarily, and so those are the kids who kind of look sometimes spaced out, they're daydreaming, they're often off task, so the class will be on page 10 and that kid might still be on page 5.
With inattention, a lot of times these kids are not noticed actually right away because they don't cause any real trouble. They're just not focused so much in school. So one of the signs might be that homework doesn't get done or assignments aren't completed fully because they're not focused and things don't get completed.
And then there's the combined type where you see the combination of both, the inattentive and the hyperactivity piece.
And then there's the combined subtype, which is actually the most common subtype and the most impairing subtype, because these are the kids who have significant attention problems and significant difficulties with impulsivity and hyperactivity. Treatment for ADHD is very essential because we do know that ADHD is a chronic disorder. It's not likely that the child will outgrow it, and in fact only about a third of children, and these are usually the kids who are pretty mild to begin with, but only a third of them will no longer meet criteria for ADHD in adulthood. And this is important because the foundation that we set today for how they manage themselves, how they establish their own routines, their time management, their organization, their planning, how they resolve conflict, how they regulate their emotions, that essentially sets the tone for what they look like as adults. And so, I'm always on a sort of mission to help parents understand we need to work on these things now so that your child develops the skills they need to manage themselves later.